Hello everybody, I'm Dr. Armen and you are on the Dr. Y channel. So we continue our lectures concerning your exams, tickets, and today's questions are all about cholelithiasis or gallstones. Okay, so what is cholelithiasis? Cholelithiasis is the presence of one or more calculi, so gallstones, in gallbladder. Gallstones tend to be asymptomatic. The most common symptom is biliary colic. Gallstones do not cause dyspepsia or fatty food intolerance. More serious complications include cholecystitis, biliary tract obstruction by stones in the bile ducts, choledocholithiasis, sometimes with infection, cholangitis, and gallstone pancreatitis. Diagnosis is usually by ultrasonography. If cholelithiasis causes symptoms or complications, cholecystectomy is necessary. Okay, so that's all about cholelithiasis actually, but we have to continue because I see that we have another questions. So my friends, take your pens, papers to make the notes finally. Okay, so gallstone is a condition. Cholelithiasis, another name gallstone. Let's talk about gallstones. Is a condition characterized by the presence of gallstones in the gallbladder or bile ducts. These gallstones are formed due to an imbalance in the composition of bile, which can lead to the precipitation of cholesterol or bilirubin crystals. The pathophysiology of cholelithiasis involves a number of factors. Cholesterol supersaturation. One of the main causes of cholelithiasis, gallstones, is a supersaturation of bile with cholesterol. This occurs when the concentration of cholesterol in the bile exceeds the solubility limit, leading to the formation of cholesterol crystals. Bile stasis. Bile stasis is another contributing factor in the development of gallstones when the gallbladder doesn't contract and empty properly, the bile and empty properly, the bile becomes stagnant and this can lead to the formation of gallstones. Mucin hypersecretion or the presence of excessive mucin in the bile can also contribute to the formation of gallstones. This is because mucin can act as a nucleation site for the precipitation of cholesterol crystals. Okay, so mucin hypersecretion, so the presence of excessive mucin in the bile also contribute the formation of gallstones. That's because mucin has a nucleation site for the precipitation of cholesterol crystals. Of course, inflammation, as any other problematic conditions in our body, we have find inflammation everywhere. So inflammation of the gallbladder or bile ducts can also contribute to the development of gallstones. Actually, this is a question. Inflammation starts gallstone formation or gallstone formation starts inflammation. Anyway, so this is because inflammation can lead to changes in the composition of bile and increase risk of cholesterol precipitation. Genetic factors also, certain genetic factors have been shown to be associated with an increased risk of cholelithiasis, including mutations in genes involved in cholesterol metabolism and transport. That's genetic, that's the determination, just family history. Overall, gallstone is a complex condition with multiple contributing factors. However, the main underlying mechanism is an imbalance of the composition of bile, which leads to the formation of gallstones. Now, clinic signs and symptoms. Symptoms of gallstones. They can vary, symptoms and signs, on the size and location of the gallstones, as well as the individual's overall health and the medical history. Some people with gallstones may experience no symptoms at all, while others may experience the following the signs and the symptoms like classic abdominal pain. The most common symptom of gallstone is abdominal pain, which is typically located in the upper right quadrant of the abdomen. The pain may be mild to severe and can last from several minutes to several hours. Nausea and vomiting. Some people with gallstones may experience nausea and vomiting, especially after eating fatty or greasy foods. Jaundice. In rare cases, gallstones can block the bile ducts and lead to the jaundice, a condition characterized by yellowing of the skin and eyes. Yes. Fever. If gallbladder becomes infected, it can lead to fever and chills. Indigestion. Some people with gallstones may experience indigestion, bloating, and gas. And finally, changing of the stools color, gray colored stools. If the bile ducts are blocked by gallstones, it can lead to a lack of bile in the stool, which can cause it to become pale or so-called clay colored. We have to understand that fatty foods are not specific causes of biliary colic and gas. Bloating and nausea are not specific symptoms of gallbladder disease. Cholelithiasis is a gallbladder disease. Diagnosis of gallbladder, of course, it's ultrasonography. It's a gold standard. Gallstones are suspected in patients with biliary colic. Abdominal ultrasonography is the imaging test of choice for detecting gallbladder stones. Sensitivity and specificity are 95%. Ultrasonography also accurately detects sludge. Computer tomography and MRI could be alternatives. Endoscopic ultrasonography accurately detects small gallstones, less than 3 millimeters, and may be needed if the tests are equivocal. Laboratory tests are not helpful. Typically, results are normal unless severe complications develop. Asymptomatic gallstones and biliary sludge are often detected incidentally when imaging. Usually, ultrasonography is done for checkup for any other reasons. About 10 to 15% of gallstones are calcified and visible on plain X-rays. So, treatment of gallstones. For two gold rules. For symptomatic stones, laparoscopic cholecystectomy or sometimes stone dissolution using desoxycholic acid. For asymptomatic stones, expecting management. Or the same desoxycholic acid. So, for patients who decline surgery or are at a high surgical risk because of concomitant medical disorders or advanced stage, gallbladder stones can sometimes be dissolved by ingesting bile acids orally for many months. And we can take this for I take for the example this desoxycholic acids around several years. The best candidates for this treatment are those with small radiolucent stones, more likely to be composed of cholesterol, in a functioning non-obstructed gallbladder, indicated by normal filling detected during cholecystectomy or by absence of stones in the gallbladder neck. Desoxycholic acid, 4 to 5 milligram or kilogram on kilogram, orally twice a day, or 3 milligram kilogram orally 3 times a day, dissolves 80% of tiny stones. Tiny means less than 0.5 centimeters in diameter within 6 months. For larger stones, the success rate is lower, even with higher doses of desoxycholic acid. Further, after successful dissolution, stones recur if you stop the treatment. So it's whole life treatment with ursodeoxycholic acid. So all we have to understand that in developing countries, so-called developing countries, about 10% of adults and 20% of people 65 plus have gallstones. But 80% are asymptomatic. Abdominal ultrasonography in 95% sensitive and specific for detecting gallbladder stones. So once symptoms develop, usually biliary colic, we talk about that, pain returns in 20 to 40% of patients a year. So treat most patients who have symptomatic gallstones with laparoscopic cholecystectomy. For another ones, why not? We can try to use ursodeoxycholic acid. Thanks for your attention, my dear friends. Don't forget to follow and subscribe the channel. See you in another lectures. Re-listening these videos several times, please.